I'm Cyd Thurman, and this is my mare, Bella Luna. This is my technician, Debbie Curtis. We recently moved our practice from Phoenix, Arizona to Eastland, Texas. The main motivation was to raise my daughter in a small town and to get out of the metroplex. Just as people have begun searching out alternatives and options with regard to their health care, many animal owners have begun asking about alternatives and options for their pets' care as well. Acupuncture is one treatment modality that has gained a tremendous amount of interest in not only the consumer but with the veterinary community as well. Chiropractic care is another option that's now become widely recognized in the field of veterinary medicine. Folks are recognizing that if these forms of treatment are being employed by the Phoenix Suns, the Dallas Cowboys, the New York Yankees, that why would it not stand to reason that these treatments would help their equine or canine athlete as well. Nutrition and nutraceuticals have become mainstream as well. We've all started to recognize in the medical field that while there are foods that feed a disease process, there's also diets that can be formulated that would do the opposite. These treatment modalities are often referred to as alternative. Personally, I prefer the term complementary, as I find in my practice that they are not a replacement for my routine veterinary care, but when employed at the right time and in the right instances and for the right reasons, they work wondrously in conjunction with traditional veterinary care. In this segment, basically what I wanted to talk about was the importance of routine and professional dental care for the equine. Gone are the days of the old cowboy float or your horseshoer coming out and floating your horse's teeth. More and more, as veterinarians, we're coming to realize exactly how important the mouth is with regard to the rest of the horse's body. With performance issues, if you have tightness up here in the TMJ joint or in this large masseter muscle, it can radiate all the way down and cause shoulder problems and or hind end problems as well. And another thing that we've realized over the years is the importance of the proper occlusion, or how the teeth come together in order for the animal to be able to properly chew and then consequently digest his feeds. Horses in the wild are allowed to graze. Unfortunately, many horses nowadays aren't on pasture and they're in stall confinement. Therefore, they don't have the natural grinding occurring with regard to their teeth. And so that makes it even more vital that their teeth be tended to either by a properly trained veterinary technician under your veterinarian's supervision, or by a veterinarian that has sought out specialty training in dentistry. A horse should have dentistry performed at least once a year. Performance animals that are at the height of their competition may require that their teeth be tended to every 6 to 9 months. With regard to feeding your animal and how you may best enable him to digest his foodstuffs in the most efficient manner, contrary to popular belief, a horse should be fed at ground level. When they drop their head, the jaw can disengage and then therefore swing in a circular motion like it's meant to. We commonly feed horses up high in an effort to keep them from consuming dirt, but when we raise their feeders up at chest level, the horse is unable to masticate or move his jaw like he's meant to. So therefore, something that an owner could do to help them wear their teeth normally would be to feed them at ground level.